Okay, this is a man who's having treatment of his flank love handle area. And back to the principles again. The majority of the tunnels are being made in the long axis of the body. Powered cannula, manual stabilization technique. You can see the marks.
The patient is lying on the side before he turns to the prone position.
And probably with his hand up above his head to stretch the skin.
So he actually extends his body as much as he can. So from what he can do towards stretching the skin, does the most what is possible. You sometimes think you can just remove the fat where it is bulging in a standing position, but in actual fact all that is an area which is interacting, so you also need to treat the whole aesthetic unit to have a uniform contraction during the wound healing and having the chance of an even removal and an even appearance in an upright standing position.
Gerhard, how often in your experience do you suction both the anterior abdomen in a man and the flanks at the same time?
In a man, nearly every time, because the love handles, as you call them, are present in nearly every man when he gets a little bit older, and this is one of the male signs of aging. So whenever you think as a male about reconfiguring your body shape, well, this is a crucial part.
But we also see love handles in women at times.
Yes.
Almost like a man.
There are different types of fat distribution and configurations, and that can be, of course, be happening very well.
We don't have liposuction of the male breasts on this tape, but what can we say about that? Is that one of the easier areas to do, or is that one of the most difficult?
This is also depending on the way you prepare it, and if you have enough tumescent fluid to soften it up and you use the vibrating cannulas, it is a very easy performance. It's one probably of the easier ones, and in the review of the past years, when everything was very difficult with the fat removal of the fibrotic tissue in the male breast, now it has become so easy since the vibrating cannulas is doing the main job for us.
Absolutely. I think pseudogynecomastia, the male breast, is really one of the easier areas to do with proper tumescence, whether you use a vibrating cannula or a small diameter manual cannulas. It's really very straightforward, and the patients love the result.
So we come here more and more to the point that we have reconfigured the waistline, and now it depends on the positioning of the patient, how he stretches on the OR table, how the OR table is bent, that we get the rest to have that nice concave curve, what gives us the youthful shape again. So the longer we work on that, the more important it is that the nurse is assisting us, otherwise we will not extract any further fat. And if you follow all that rules and you suction from superior to inferior, then suddenly you get to new fat deposits where you thought they wouldn't exist. Also here in the prone position, additional fat is removed, and now we're getting more and more to the indentation, the way we really want to have the look again of that young body. I think at the moment the hand is covering that area, but you see that we have this. Now he can see that it's a real nice waistline again.
And as we get closer and closer to the end of the procedure, the more and more the stabilization technique becomes important.
Yeah. Otherwise, you will not be able to have any access to to fat anymore, and you more and more destroy the suspension apparatus of the skin, the connective tissue.